you're
I'm
I'm
recording
just
too
hope
as
you're
well.
impressed with these two doctoral degree people who
Yeah.
can't get the recording on Facebook correct here, but I think we've got it now.
Yeah,
Yes.
we've got 21st technology here going. This is a first. As far as I'm aware, this is the first time that two people without the aid of any, young communications experts have managed to make this thing work. I mean, I've done Zoom before, and I know you have, but I've never done it live, really live on Facebook. But it looks like that's working now. And if it isn't, I'm recording it. So I'm here on the very first time, actually, interviewing somebody on the new Blood Cancer Uncensored channel. And really, it's here I just want to get to the sort of bottom of issues and hear people's stories. And so, Brian, I see your name all over the place in terms of the science. And I know you've had CLL, and I know you've had CAR-T recently, but I'm interested in just going right back and saying, how did you decide to start a whole organization called CLL Society, and what was your journey in a nutshell?
Sure. Thank you. And thank you so much, Adrian, for what you're doing. And I think it's really important that people be able to share their journeys and learn from each other, because everybody's at a different point and everybody's story. The thing about CLL is it's heterogeneous. Everybody has a different story to tell, but there are touch points that are similar. And there are things that you can only learn from a fellow patient, that your physician, no matter how charismatic or caring that physician is, how knowledgeable they are about the disease, cannot walk a mile in your shoes like another patient can. So I think the role of patients and caregivers is extraordinarily important. And sometimes I get a little too stuck in the science. So I'm really glad to see that you're covering that other side. You're sort of the antidote to some of the kind of geekiness I get about the science.
Yeah,
So
well,
I was diagnosed with I was diagnosed with CLL 15 years ago, and at that time the prognostic landscape was pretty poor. And I learned very quickly, again, not so much from doctors, but from other CLL patients that were on sort of a fledgling network on the internet, that it was important to get an expert on your team. And I did that pretty quickly and found that there were some radically different kinds of approaches that I should be looking at. And it became very quickly apparent that it was important to be your own advocate and to be smart about the disease. So I started, because my journey was a little complicated, I had an autoimmune complication where I attacked my own platelets called ITP, or immune thrombocytopenic purpura, and I had multiple hospitalizations. I bled. I lost half my blood internally. I looked like I was 6 months pregnant. I had massive bruising and nosebleeds, all kinds of terrible stuff, emergency removal of my spleen to try to control things. It was a bad picture, and I started to tell my story, and my kids said to me, "Dad, it's so old school to write emails to everybody. Why don't you start a blog?" So I started a blog, and the blog became extremely popular. And then I kind of leveraged the contacts I had as a physician. I'm a retired family doc. I was actively practicing that to have contact with the top CLL specialists around the world. And then I'd interview them and explain things, hopefully in a patient-friendly way. And the blog became very popular. But I realized that the blog was telling the story in a chronological kind of vertical way, and I needed to tell it more horizontally and more in a sort of decision tree kind of way. So we set up a website to teach people about things, and that became the nonprofit CLL Society. And at first it was just kind of porting over the blog and attending the major medical conferences. But then we started setting up support groups across Canada and the USA, which is where we're based. So now we have 36 support groups going. We started doing research because we wanted to make sure that the patient's voice was heard in these decisions. So we'd be surveying patients and then presenting it to a professional audience like the American Society of Hematology, or ASH meetings, the European Hematological Association annual Congress, or ASCO, the American Society of Clinical Oncologists. We've had major papers presented there to inform people about what's going on with the patients, not just to assume that the expert knows what's important to the patient. We've done advocacy to help control the costs of the medicines or to get medicines onto the formularies in countries which sometimes look at the dollar rather than the compassionate need of the patient. And we offer support in all different ways at live educational forums, webinars, all of these kinds of things. And I think you and I can relate to this. I tell patients, use every advantage you have. And you and I share this advantage, Adrian. We're physicians. So we know a little bit how to manipulate the system. We know we can understand the verbiage. We have that advantage. So we've used that advantage to ensure our best possible care.
Yeah,
but
I don't think I'd be alive without that, Brian. I don't know about you, but
and me
I really don't think I would.
If I'd listened to what my doctors told me, I wouldn't be here. It was only because it didn't smell right to me, and I researched it and got an expert on my team, and I took a different course than what was recommended to me. I jumped into phase one clinical trials. I mean, but where I'm going with this is, I think that we have, with that extra ability we have to see around the corners and to understand things, I think there comes a responsibility to share where we can shine a light into some dark corners and explain things. And I think you and I both have that ability. I think that there's a responsibility for us to share. So everyone, you don't have to have an MD at the end of your name to get the advantages that we have. So that's what you're trying to do with your Blood Cancers Uncensored, is for people to be able to share their experiences and learn from each other. And I'm doing it, and you're doing that more in the philosophical and religious and spiritual areas. And I'm doing it in the medical area at cllsociety.org. That's what we're doing, is trying to bring everybody up to pace. Our motto is smart patients get smart care. I think it would, this isn't about me. This is about getting the story out so people can learn from my experiences.
Yeah, and I guess though as well, you must, I'm assuming, have been a bit like me, because certainly when I was first diagnosed, I'm afraid I didn't really remember any hematology. And so, any that I had have known would have been 22 years out of date anyway. So it would have been even worse than Dr. Google. I would have been seriously out of date if I had remembered any of it, because psychiatry and hematology don't really overlap too much. I guess as a family doctor, you might have been expected to know a little, but most family doctors don't see many patients with blood cancer in their whole careers, do they? Or they may see them, but they don't usually identify them.
Yeah, so I just wrote my board exams for family medicine. I have to write those every 7 to 10 years. And 1% of the examination is on hematology. So what do you think most docs are studying when they're doing their board exams? They're studying, orthopedics, pediatrics, gynecology, internal medicine. They're not studying psychiatry. They're not studying hematology when it's 1% of the exam. I think there was 3 or 4 questions on 5 hours of testing on hematology. And we're frightened of it, so we just send it off to the specialist immediately.
Yeah. And yes, of course. I mean, actually, a good GP, once they understand that they need to perhaps be more aggressive with the antibiotics rather than with a normal patient, could be very helpful. And I've certainly found that with my own GP. But I kind of had to educate them. And funnily enough, that wasn't even so much that the hematologist was educating me. I've noticed that there's a bit of a disconnect, and that's something we can talk a little bit more about at some other time, I'm sure, that where perhaps our two sort of visions connect a little bit, because if the hematology is sort of not really talking to the GP, that can be a real problem. But I'm guessing as well, though, you probably had a similar thing to me, where you had your own journey of knowledge and discovery. I mean, it must feel a long time ago, but I'm also pretty sure you probably remember the day you were diagnosed and how you felt when it all felt so strange. Can you take me back to that day, Brian?
Yeah, sure. So I'd noticed I noticed some bumps on the back of my neck, and I thought they were cysts. They were soft, mobile. They didn't feel hard like cancer, and I really kind of ignored them for months, and they kept growing. And thought, I'll get some blood work, on this. And so I ordered some blood work on myself, which you can do. And I remember
we can't do that in the UK, but yeah.
And I remember getting back the results and being very happy how good my cholesterol looked and my blood chemistries, but my white blood cell count was elevated, and it just caught me by surprise. And soon after, I had a flow cytometry, and then I found out that it was CLL. And then I had prognostic testing called FISH, and the first blush said I had a 17p deletion, which is awful back then, 14 and a half years ago. There was just no treatments. It turns out that was probably an error, and it was 11q, but I was unmutated and ZAP70 positive and CD38 positive and all these terrible markers. And since then,
that's so encouraging to hear that you're still here, because I think a lot of people, if they heard they got those markers right now, they would be worried that they wouldn't make it for 14 years. But
no. It's, and I have no measurable disease at this point. So all of this was happening, and my oldest daughter's wedding was coming up. So I'm Jewish, and in the Jewish tradition, there's in the Talmud, which is a commentary on the 5 books of Moses, there's a saying that if a funeral and a wedding come to the same corner at the same time, the wedding take precedence. So it's choose life over death. So my wife and I were really struck by this horrible diagnosis with what looked like a terrible prognosis. And we hadn't really sorted things out, and the wedding was coming, and there was all the joy of the wedding. So we didn't want to ruin the honeymoon. We didn't want to ruin the party. So we had to keep quiet about it. And my kids had all flown in from college and stuff to be at the wedding of their sister. And I remember we waited till the day after the wedding, and then we told them each individually, before they flew back, because we didn't want to have to tell them over the phone, and how difficult that was, and then when my daughter got back from her honeymoon, we let her know. But it was a very tough time for my wife and I during that period, because we really didn't have a sense of the future. And you and I have talked about, in CLL, it's the uncertainty of what's going on, and it's you don't know how good or bad it's going to be, because a significant percentage of us never need treatment, have a normal life expectancy, and then others can be gone in a year or two. So and you don't know where you're going to be, even with knowing what your prognostic factors are. So dealing with that uncertainty, one of my rules to live by in CLL is you have to make life-changing decisions with incomplete knowledge and with conflicting advice.
Yeah, and I mean, that's certainly true at the moment. Because would you agree that there's very often situations right now where you've got 2 or 3 different options that, on the face of it, all look okay, but maybe it's not always easy to know which one to go for?
Right, and that's why I think it's important to be knowledgeable about this. And those 3 to 4 options, may be presented to you by a CLL expert, but the community hematologist, who might see 1 or 2 cases of CLL a year because it's such a rare disease, the general oncologist, he or she may not be on top of how radically the treatment has changed in the last 5 or 6 years. I mean, CLL treatment now with targeted oral therapies has been revolutionized. And all the data that looks so depressing when people look at it is all looking backwards. None of it's looking forwards. The forward-looking data is marvelous, with tremendous response rates and overall survival data.
Yeah, this is great, isn't it? So, I mean, you mentioned about the expert, and that's really interesting, because I'm passionate about that, because I genuinely believe that if I hadn't seen an expert early on in my disease, when I wasn't even needing treatment, I was just having infection problems. I had pneumonia at the time. I think I wouldn't be here today. So how do you advise someone to go and find out about an expert? I know you've got a list, and then you've got this wonderful thing. How did you persuade them to offer their services free online? I don't get that. What happened?
Sadly, that's only in the U.S. That service. We have this expert program, and not all of them do it for free. We pay some of them, but we get grants from generous individuals to help underwrite that. We're a charity. In the U.S., it's called a 501c3. We're a not-for-profit. So people give us money it's along with what other charities they support, and it's tax deductible and all that stuff. And plus we get grants from pharmaceutical companies that are in goals align in that we want to see patients get their best care, and often that best care is an expensive new shiny medicine that works really well. And so the pharmaceutical companies, we talk about those medicines and why there's advantages to them. So we're not always aligned on all the issues of the pharmaceutical companies, but in terms of patients getting their best possible treatments, often we're very much aligned with them. So that's where we get the funding for this. It was when I looked around, the largest unmet need I saw in the community was people not getting the best treatment. There's great treatments out there, but people weren't getting them. So a grassroots way to do that was to provide a free consultation, and that was way before COVID. So now it's even more helpful because it can be done from the comfort of your living room. You can just get a free consultation with a CLL expert, and then they go to your community hematologist, and you've got advice from a doctor from the National Institutes of Health, or a doctor from Dana-Farber or MD Anderson or Ohio State, to help you make a decision.
It's a really wonderful thing to do. It's a really giving thing to do. I mean, it really does for me. I was really interested to hear you mention that you were Jewish, because it sort of resonates with that kind of Judeo-Christian view of the world, where we've got to do a bit of good for other people and not just think about ourselves. And yeah, of course, people without faith think that way as well. But to what extent has your faith partly driven you? I mean, have you become more a man of faith or less of a man of faith in CLL? Because I know it goes both ways sometimes.
I'd have to say that it's kind of fluctuated.
Yeah.
And the reason is...
It happens with me, mate. I tell you, people think I'm some spiritual person, but yeah, carry on.
Yeah, because faith demands time, and so when I was first diagnosed, I spent a lot of time meditating and studying, and in Jewish studies and Talmud classes and things like that. And then as the not-for-profit got so darn busy, it's just, I hardly have a chance to read anything except scientific journals. So I kind of ache for that, and I've kind of moved away from it, and I miss it. My daughter, I do a little bit of a Zen practice and meditate and stuff, which
wonderful.
Is not kind of a Jew boo, they call us, a Jewish Buddhist. But there's wonderful. My daughter says, you should meditate for an hour every day unless you don't have time, in which case you should meditate for 2 hours every day. So I'm in the category where I really should be meditating for 2 hours every day, but I'm lucky if I get to meditate once or twice a week. So it's I miss I miss that part of my life because I'm so busy with the charity. And that's if I could give a guidance to you've got to sharpen your own swords a little bit sometimes, Adrian. If you're always on give and never taking care of yourself, your own life can fall into disrepair, and the people that are most intimate to you may not be getting the attention that you need, or you yourself may not be getting the health. And especially now that we're locked in, getting our own exercise, getting our own nutrition, getting a good night's sleep, all of that stuff is so important. So I think that's an important aspect of this too. But I do miss it. I do miss when I was more involved. I just want to touch on one other thing.
Sure.
And that is that, it's not all that altruistic to do this. I mean, first, it's just the right thing to do. It just feels like the right thing. So I get a lot of joy. It's as we all know, it's better to give than to get. And to be in a position to be able to give is amazing. But I get a lot out of it. I can, because I've been doing this for so long, and I'm so well known I'm a big fish in a little pond, a very little pond. So that makes me look even bigger because there's not that many CLL patients out there, and there's a handful of us well-known patients out there. And because of that, I have access to the top doctors. So I can, text one of the top CLL doctors about if I have a personal medical question, and he or she will get back to me. Or if I want to find out about something, I can have this kind of call with them to find out, and then I might share that. And they're interested too, because they want to get the word out about a trial that they have open or something that their institution is doing. So it's mutually beneficial. It's not like I do this all in some altruistic, self-sacrificing way. I get benefits from it too, because a lot, I got into these 2 phase 1 trials. How did I know about them? I knew about them because doctors knew me and were open to say, hey, Brian, there's this phase 1 trial in Ohio. You might be interested in it. Brian, there's a phase 1 trial of CAR T therapy at the Fred Hutch in Washington State. Maybe you'd be interested in that. So people were letting me know. And it was not my local community hematologist, because he didn't know about these trials. It was that larger community that I'd moved into, and they knew me through the work I was doing through my blog and then through the charity.
Wonderful, wonderful. I'm very conscious that we've taken a fair bit of your time. I feel like I could talk to you for hours, Brian. I'd love to know, for example, did you have a crisis of faith? Because I think most of us do, and you didn't really touch on that. And the angst, I mean, I'm sure it's all there. I mean, it must be felt a long time ago. And I guess that's one piece that I take away from this is just, CLL's become your life. It's become such a huge part of your life. And I think I'm only 3 years in. It's actually 3 years today that I got my formal diagnosis, Brian. And it still feels quite early. It still feels quite fresh. I mean, I've had chemo, I've had surgery, all sorts of things have gone on in that time, including the pneumonia and, essentially losing my career. All of that stuff has gone on. So it's been a pretty traumatic, bumpy ride. And I think many people in the early stages think, is it ever going to feel normal? But I guess, I'm guessing that one thing you would say is, yeah, I mean, this is now part of my life.
So let's revisit, because I don't want to give a short shrift to the issues of crisis of faith or how the anxiety is. But the short answer that I would say is that one of the things that I still struggle with is how to find a balance in this, because this can be a 24/7 endeavor between, and especially now with COVID, because I'm constantly reading. I mean, I can't, and people are sending me articles to read, and then I can forget to eat lunch. I can forget to hug my wife. I can forget to do the things that are important in life. So I'm not good at that balance. I think that sort of comes with being a doctor, that we're kind of trained to be kind of out there. And we've read tragedies of doctors who've gone out, who've given so much with the COVID-19 that it's cost them their lives. So I think that that's something I'm not good at, is how do you care for the caregiver, those kinds of issues that I'm still struggling with. So I think that that's a theme that needs to be explored. And because if you don't take care of yourself, you can't take care of anybody else. And
well, there you go. So that's maybe a good place to stop, because there's so much more we could talk about. But you did tell me that you wanted to be finished by the top of the hour, and I'm a good man.
Right.
I need to stick to my word, because you've got another call, and you need a 2-minute meditation right now. Okay, just one of those breathing exercises where you just get in contact with yourself, ready for the next installment of Brian's busy day. So thank you so much for joining us, Brian. And perhaps we can do this again sometime, and we'll see where we go with all of this.
To be continued. Thanks.
Oh, that's great.
Send me a copy of this. Can you get me?
I will do. Yes, it will be online. It will be fine.
I'll link to it.
Yeah, I will do.
I'll link to it.
All the best then. Bye-bye.
All right, thanks. Bye-bye now.